one thing that we've talked about, I spoke with a migraine specialist the other day who has sort of switched her care entirely to telemedicine currently, her practice. And it's sort of her first foray into that. And it made me think, obviously a lot of physicians are now really experiencing for the first time a full-on telemedicine approach. I'm curious, do you foresee any sort of permanent impact on the use of telemedicine post-pandemic?
I do think so, and I think it'll actually only benefit our neuromuscular community because obviously many patients with mobility issues find it very challenging to travel to the site to be seen. We will have to implement some aspects of direct data collection that aren't readily available by a telemedicine format. For example, especially now in the wake of these respiratory illnesses, we don't have a ready means for doing pulmonary function testing, nor do we have the best means for physical function assessment or clinical evaluations that might benefit from the physical therapy clinical evaluator session that they have during conference. We're going to have to work out how those things are done in the home with remote tracking of activity, and so activity monitors are useful as surrogates for their mobility testing, and there are Bluetooth accessories for pulmonary function testing or spirometers that would have to be distributed to patients to use in conjunction with their their personal device.
And how, obviously you mentioned a couple challenges there. Have there been any additional challenges outside of, the ability to measure certain aspects?
For a while, there's been means to do home nursing used more often in the research arena than in the clinical arena. But laboratory assessment can certainly be done through home nursing visits. The rest of the assessment can be adjusted to work on the telemedicine format, and then we can make sure that people have the needed health maintenance that's required over time. And then we'll just lessen. I don't think this will completely replace the face-to-face visits. It just will lessen the frequency. And I think probably, in fact, in many cases, improve access to care for some families who don't have the ability to either be transported to the place or can't coordinate a visit with multiple providers at once. And we're setting up a virtual meeting room so the patient actually stays in one place and the multiple providers that are part of the multidisciplinary team have appointments. It forces everyone to be exactly on time because the next person comes in whether you're finished or not. So that is going to, I think, also make it much more convenient and comprehensive for patients.